Welcome to Forward March, the March Air Reserve-based short-form video podcast series. On this episode, we're going to be talking about holidays and holidays lessons learned. And for our guest, we have Captain Marissa Hopkins.
Hi.
Maybe can you describe what your title is and what your job is on base?
Absolutely. I am the public health officer for the 452nd Air Mobility Wing and the emergency officer. So they threw a little emergency in there. And I think that's just to differentiate the fact that the slot that I'm holding at the moment, or the position, if you will, it is a clinician. So I'm an infectious disease provider. And that, of course, was a little
So you provide
appropriate.
infectious diseases?
No, I like to avoid them or help people overcome whatever infectious disease issues that they have. But certainly
Sorry, it was an easy target. I had to.
No problem. So yes, I kind of help. I work with Mr. Marshall Prude, our public health director, our officer here on base, and we work in conjunction. We don't have exactly the same backgrounds, so it's a perfect joining of a team, if you will. So yeah, that's what I do. I help manage and oversee our contact tracing and help implement policy, advise the installation commander on ways to go forward during the COVID-19 pandemic.
Yeah, you must be insanely busy. So we'll get right to some of the questions we have that I'm sure a lot of folks, if they're paying attention or wanting to listen to us, have. So and what would you say to folks that are possibly planning to have more than one household gather?
I would say that, well, right now I would not recommend it. This is probably the worst that we've had any kind of surge since this whole pandemic started in March, at least for California and for our March Air Reserve base members. But if you do choose to, I would say make sure, if you happen to be sharing a bed with someone, like if you're going to bunk somewhere and then the next night somebody else is going to do it, make sure people are changing out linens. The CDC, of course, they have a phenomenal website that has a lot of these recommendations on it. Make sure that I would definitely recommend getting your flu shot because it's exceptionally impossible. Medical providers are not Superman. We don't have X-ray vision. We are unable to tell some viral illnesses from another unless there is a laboratory confirmed diagnosis. So if you can at least try to reduce your risk for any kind of illness by getting your flu immunization, that would be phenomenal. And besides, it's an IMR requirement. Make sure you are washing your hands very thoroughly. Which, by the way, just as a reminder, I did a little research project once on hand washing. It's the friction that helps get the little bacteria or virus particles off of your hands. So if you wash your hands, just make sure you're really rubbing vigorously. And make sure you're trying to avoid touching your mouth, nose, and eyes. And with your mask wearing,
yes, let's go over that, please.
Okay, you have to forgive me, my mask here. I actually threw it in the wash the other day, and so it's not ironed. But if you're wearing your mask, you do not want to
iron a mask.
Well,
You're going to be ironing the mask.
No, but it just is so wrinkly here. Anyhow, so you want to make sure it's going over your nose and it's not under your nose. So like this.
Also, and I think you showed it, but for the folks that are listening and not watching, so she wanted it about the bridge of your nose and then covering underneath your chin as well.
Absolutely. Thank you for speaking it, since I was just giving a visual.
And like you said, you had mentioned some CDC guidance. Also, we'll be putting that in the notes wherever you are, also on social media. That way you can find information to be self-reliant and self-governing, as well as just protecting the mission. If you're planning to travel, how do I travel safely, or how can I find information on how to travel safely?
Well, that also actually on the same CDC webpage for the holiday guidance, they have some specific uh, recommendations for holiday travel. And not just to reiterate what the CDC is constantly saying, but they have some very good pearls of wisdom that I think have hold true. Number one, if you can possibly wear a surgical mask when you're traveling, or if you happen to have an N95 mask, not that I'm recommending that you go and buy out, a whole horde of medical grade N95 masks, especially right now when the all of the healthcare workers really need them. But if you happen to have one, I would not be unhappy if you had to have commercial air travel, just because you have a large number of people in an enclosed space with that pressurized airplane, and that can be an issue. But some of those same infection control recommendations are exactly the same when you're traveling. If you have to go somewhere, like even to the gas station, I like to use just a little bit of hand sanitizer right after I touch the gas pump. And then, you can definitely, like, I know for a fact that one of the dirtiest parts of an airplane are those fold down food trays, because they just don't get sanitized the way that they should be. So if you have to use it, and you have a very small bottle, travel approved size bottle of hand sanitizer with you if they allow that. I haven't traveled commercially for a long time, but anyways, those are sort of some of those things. Make sure you wash your hands well. Don't touch your eyes, face, nose, mouth, the whole area up here. Those mucous membranes in your eyes and your mouth are very the transmission for virus and bacteria is very easy and fast. They don't have to go through your immune system. Like, we have a great immune system, but there's not middle layer barriers for those mucous membranes, so you can get sick quick by touching your eyes.
Yeah, nobody wants that at all. Yeah. Well, thank you for joining us and giving us some tips and tricks for trying to avoid COVID-19. So for folks that are listening, we will put all the resources that Captain Hopkins has mentioned into the notes with links. Also, be sure to check out our battle staff directives that give us good information on what to do if we're going to be coming back to base after travel or after a holiday gathering. There's the Raptor tool and many other resources that we're being asked to use. But as we close out, as is our new tradition, we are going to ask our guest, Captain Hopkins, to close out with the Protect the Mission call out. Are you ready, ma'am?
Absolutely.
Awesome. So on the count of three, let's say protect the mission together. Ready?
Yes.
1, 2, 3. Protect the
The mission.
For more information and resources, check out our social media and website at the links below.